Dr. Dusty here. So today I'm going to cover a topic with you regarding chiropractic care and your spinal discs. So I've covered some of this on a previous video, so I'm going to go over a little bit about injuries to the disc. Now first off, we have what is called a normal disc. And in the normal disc, you have a matrix of fibers that are laid out to really give the disc a lot of strength. You have the inner core of the disc, which is a gelatin, watery type substance. And then you have the outer fibers that hold the disc in place. So the disc is kind of a rounded oval type shape. Now, as the disc begins to develop problems, you can progress into what is called a bulging disc. Now, a bulging disc is where the disc is actually starting to lose its shape and the inner nucleus is starting to kind of push out and give some pressure, and it gives you that bulge type of a thing there. So the bulge that I'm talking about is kind of like the tire that has lost air, and the tire is kind of bulged out past the rim itself. So that would be a bulging disc. Now, the disc can also go into what is called a herniated disc, or a slipped disc, or a ruptured disc. And in this case, the herniated disc or slipped or ruptured disc can actually have the middle substance, watery substance, be pushed out, leaked out through cracks in the disc caused by injuries or aging or so on and so forth, which I'll cover in just a bit. But that is what a herniated disc will look like. A herniated disc can cause some problems. Now, so can a bulging disc. And the biggest problem that can cause is actually pinching your nerves as they come out the spine and your spinal cord. So these are problems here. Now, causes of bulging discs or herniated discs can be aging, poor spinal alignment, can be a bad diet, and eating bad foods. So of course, to improve your diet with better foods and supplements, you can like glucosamine sulfate and chondroitin sulfates, you can make your disc do better. Also, injuries to the spine and the spinal discs can cause problems. Now let's talk about aging a little bit. There's a medical professional that in 1988 wrote, "Aging and degenerative changes, arthritic changes, are not synonymous." So basically we can look at a bulging disc or a herniated disc as being degenerated in to a certain degree, degenerative disc disease. So Harry Farfan, the medical doctor, writes that just because you age doesn't mean you have to degenerate or get arthritic changes. Now, the next one is poor spinal alignment. So this medical professional wrote in 1957, "Deviations in the body's center of gravity cause poor posture." And you see those people walking around with their head forward, they're tilted to the right, tilted to the left. They just don't walk very well. Those people have deviations in their body's center of gravity. So deviations in the body's center of gravity cause poor posture, which resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and a shortened lifespan. Again, that was written by J.T. Freeman in 1957, and that was posted in the Journal of the American Medical Association. So pretty interesting write-up on poor posture and deviations in the body's center of gravity, which are really caused by spinal misalignments. Again, bad diet. So what do? Well, you eat better foods and you take supplements. Injuries, that can be any kind of thing where people pick up things incorrectly, they sit too long or whatever. Again, that leads to poor spinal alignment. That is solved by chiropractic adjustments. All right. So there's also some other information that this Kapanji wrote. He says, "For every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. So when a person is walking around with their head forward and they've got 1 inch, 2 inches, 3 inches of forward head posture, it increases the weight of their head on their spine by 10, 20, 30 pounds, depending on how far forward it goes, all right? And again, those people will have a lot of strain in their upper shoulders, their upper back. They'll begin to develop this hump in their upper back, which is a sign that they have forward head posture and the body is trying to compensate. And if those people even try to stand up and have better posture, they can't because they have poor spinal alignment. So in effect, bad posture is really caused by poor spinal alignment. All right, so there you go. There's quite a few discs in your spine. You have 7 neck vertebrae, 12 mid-back vertebrae, 5 lower back vertebrae. Each of those has a disc in between. So there's really a lot that can happen with that spine. And to really keep it in better alignment, you need to have chiropractic adjustments, all right? So my contact data is below. Give us a call at the office. You can talk to me or talk to Ryan, talk to our front desk person, and you can get scheduled for an appointment. If you have questions that you want specifically answered, I can get on the phone with you or shoot us an email and I can talk to you via that, all right? So again, our data is below. If you like this video, please push the like button and forward it to other people so that we can help people get better through chiropractic care and natural health care. So see you soon.